Hi, this is the Chronicles of Moving Mountains, and today I wanted to go over the healthcare proposal that I wrote, and this is based on a free market. So, how I came up with a legal proposal is because I go to Liberty University, and I was really glad that I took the course because I didn't know how interested I would be with really getting this stuff done. So, looking at the Obamacare right now, the problem with it is the Medicaid expansion, and two is also it is forcing employers and employees and individual mandate and employee mandate at the same time. And how the government has come up with this is because they see that the third party insurance, if let's say you hire 100 people and each one of them paid $500 in there, so you've got a big pool of money, and they can all share that money when it comes down if one person gets sick and what have you. Well, they found that only 25%. So let's say a company has a health insurance plan, and everybody puts their money into it, and out of all the employees, they come up with 500,000. Well, only a handful of them will get sick or get pregnant and give birth or whatever. So about 25% is used out of that pool. And this is the reason why employers want to hire healthy people, young, healthy people. So what happened there is that with the insurance, they get a lot of money from premium, and that is not one person's account. So that is a pool of people, which is, if you're a healthy person, that money just goes down the drain. But if let's say you have an IRA that you can kind of use, a medical savings account, then you can use that money and you can pull that money. Okay, you put your dollar in that piggy bank, and that's your piggy bank anywhere you go. It's yours. But if let's say you quit the job, so this one pays really good insurance, have really good insurance. It's a big business, a lot of employees. They're all putting money in it. Then you're kind of safer there if you need money. Insurance will pay for it, but the insurance only pays the 25% out of that $500,000 that they get per year. So the government realized, oh well, why don't we get that money instead of them getting the money? Because we've got deficits, we got bills to pay. Which is kind of wrong, because now they're not only taxing the employers, they're taxing the employees if they don't have the insurance. And they're also trying to make money out of Medicaid, but Medicaid is a third-class insurance. And this third-class insurance is what the government wants for a first world nation. So this is not making any sense at all. So I looked at some of the things that's happening. So we base it out of cosmetic surgeons, LASIK, cosmetologists, just like if you get massage and all that stuff. It's more of a free market, because that one's like, okay, I'll pay. I don't care for the insurance paying. I will pay for it off of my pocket. Okay, I will pay for it off of my pocket. So with healthcare, of course, it's going to be much more costly. But if the insurance can see the prices, and I can see the price of what I'm going to get if I'm going to get a knee replacement, then, and the hospitals post, how much is it going to cost me to get my knee replaced? And the other one, 5 hospitals shows their prices. Then it will be very embarrassing for any one hospital to be charging 30 grand more, right? Just like if I go on Amazon and I buy a book. Let's say I'm going to buy a phone. So I'm going to buy a phone, and I know it's all Apple phone. Then I'm going to go for the cheapest one, right? So if one is 10 cents lower, maybe I don't care, but it's a reliable, place, then I will probably don't care about the 10 cents. But if it's, let's say, a difference of $100, well, I'll go for the cheaper one, right? So the same thing's going to happen with any procedure that people have. They're going to look at the rating of the hospital. They're going to look at the rating of the nursing home. So my proposal is a 2-tier free market competition, and that is going to be posting their prices So the posting of the prices and also the provision of care can be modulated. That's the part where the government can step in and introduce and establish a health information network, and government subsidize it for hospitals that doesn't have the money, because it can cost money to have all of these details in. But the healthcare information network can actually have a saving of over 500. I wrote it down here. $513 billion, a cumulative saving over 15 years. From 2002 to 2015, greater efficiency and savings would be 513 billion to 371 billion from hospital systems and 142 million from provider systems. So that is a very good way to actually reduce the cost, is through health information network. Now, instead of having employer mandate, it should not be an employer. Just keep it at an individual mandate. And we should not be using Medicaid expansion because, again, Medicaid is a third-class insurance and it doesn't provide for much. So what should be done is a more of a first tier where young and invisible people would put their money. Okay, and then for also critical care, will put their money in medical savings account, or if they can't afford it, it should be subsidized by the government. So I call it the wellness card. So have a wellness card that if there's, like, say, I was only 18, I didn't know I'm going to have appendicitis, that even though I'm in school and I don't make much money except for, like, $10 an hour, then at least if I had the job, my insurance can pay for my appendicitis. And I'm not going to be bankrupt before I graduated college. So that, I think, is a very good, because I know a lot of students, you got 47, now we had about 41 million without insurance. But the key thing there is not to knock down all and give access to everybody. There should be money allotted for charities, nonprofit organization, hospital. So what they had found, if you look at the VA hospitals and many government-based hospitals, they don't really have the highest healthcare indicator. So why build more hospitals that are government-based? Use that money that you're going to put for those buildings into charity grants. And charity grants is like they really oversee how the people are using that money. There should be an stringent, careful look at how the money is being used to literally affect people that are indigenous, people that are doesn't have a disability, or people that doesn't have the money or have mental issues. So everybody should really pay the first year at least 4% or more if you're working. And so that should be part of the individual mandate. So the person working should be the one that gets taxed if they don't choose for a medical savings account. In which case, if I am working and I know I wanted health care, and I know that my living expense, I should probably ask my boss for a little bit more money to cover for my health, or to get a lesser rent. That way I'm responsible. I know that I gotta have my insurance. If I needed a car insurance because I have a car, I also must have a medical insurance to take care of me and prevent me from going bankrupt. So that would make sense. So the first year would be a little bit more subsidized by the government for the people that are low income families. And then that is different from a Medicaid expansion, because a Medicaid expansion does not allow that person, if they're on Medicaid, then they make so little money. They're not going to want to prove that they make more money. They're going to not want to either get a better paying job or not get more work because they're afraid they're going to lose their Medicaid. So it is wrong to expand the Medicaid. And already we're 18 trillion. So if it's already hit, we're already at the ceiling, they probably can't keep pushing it up. Then that means that everybody why are you suppressing the employers, right? Because what happened with the employer mandate is that it squeezed out a lot of the employers, and they are unfair. They hire somebody who happened to be a drug addict. They got to pay for that person's health insurance, and then that person end up with so many things. It's going to deplete their insurance money. They're responsible. It's like the employer is responsible for this person's health. But if they make it so that there's an incentive for the employers to cover everybody and their insurance, then they should get an incentive like reduced business tax, or they get a rating system. And if you get a rating system, you look better. Oh yeah, I'd want to give insurance to people. So also, the free market allows people to be responsible for shopping for their health care. They're also responsible for, they're a little bit more savvy in terms of, okay, what do I need? And I need to save money. So you encourage people to save money through the free market competition, and you also allow the businesses to show the prices of what they do. So it doesn't cost people too much, but they'll still make a profit. And so what if they are profit or non-profit, as long as they're giving good service and the people are getting cured and they're getting good surgeries, so on and so forth. But at least they're getting the right amount of money from the insurances. Not like, oh, okay, well, this is the price. You said you wanted to pay for this, but we took the care, but you don't pay. But the more people that are on payroll, the more you can pay for Medicare, and you can pay for Medicaid, and everybody should put some money in that. 2 to 4% of their income, depending on their income. So everybody should still be paying for that, and Medicaid and Medicare should not be phased out. But there's no way you should be expanding this Medicaid, because Medicaid is only supposed to be like if somebody has no insurance or they're illegal alien and they come in and they ended up in a car crash, they're taken to the emergency, somebody has to take care of that person, they have no money, they have no insurance. So how do you take care of them? It's through Medicaid. But that Medicaid should be a smaller number of the population, not like just put everybody that makes minimum wage into a Medicaid. That doesn't make sense, because the people are not going to want to earn more money because they don't want to lose their Medicaid. So, so going on, another thing that I wanted to propose to put money into the wellness card, and for the government to make money out of this wellness card, is to increase the taxes on what they call the fat tax, junk food, fast food, whatever fatty food, sodas, lottery, and also, perhaps, you could even pretty much do a casino and, get money from that. But whatever it is, they can pull money from different areas, the sin tax, like cigarettes, so if they tax those things, and then that money that was put from those things that are extra tax, it will make people not want to consume too much of it. And now you're probably going to say, well, that's going to be hard on the people. Well, you know what? If McDonald's wanted to keep their business, then what they're going to do is lower their price range and pay the tax. Okay? Lower the price rate and pay the tax. But at least people are like, well, I don't want to be paying more taxes if I'm paying for, because I'm eating junk food. So that is a deterrent. And either way, it's kind of like, it's still a win-win situation. Because people are still going to eat fatty foods, and they're still going to eat, and they're still going to get sick. So we'll tax them for those bad stuff. 1 to 2%, no biggie. So, but it all adds up, and that it gets placed for subsidies for wellness card for the people who doesn't have a very high income. Now, I shall continue on because I'm really enjoying this. And then I have other programs that I wanted to go over, but on the next one.